Hello, my name is Tatum Conklin, and this PowerPoint presentation will be a review of the organizational assessment of Cotton O'Neill Dermatology. The objectives of this presentation are to understand and apply the core principles of quantum leadership to an organization, unit, or department, critically evaluate nursing leadership effectiveness in complex and dynamic systems, to identify patterns, how energy flows, and cultural dynamics within the organization, unit, or department, and to develop evidence-based recommendations to enhance adaptive leadership and organization transformation in a complex system. The healthcare organization that was selected for this assignment was Stormont Vail Health, more specifically Cotton O'Neill Dermatology. Cotton O'Neill Dermatology is located about a mile west of 29th and Urish in Topeka, Kansas. In our department, we currently have 26 nurses, 5 physicians, and 2 physician assistants. Our hours of operation are Monday through Friday, 8 a.m. to 4:30 p.m. We are currently accepting new patients, and a referral is no longer required to get scheduled for an appointment. The why of Stormont Vail. Stormont Vail's mission statement is as follows: working together to improve the health of our community. The organization's vision is to be a national leader in delivering compassionate, high-quality, and efficient integrated care through collaboration, resulting in a healthier community. Lastly, their values include quality, teamwork, respect, and viability. We provide an environment of trust, comfort, and confidence built on a competent, compassionate, and caring staff. We do together that cannot be done alone. We honor the dignity and creative potential of each staff member, and we assure our mission by remaining profitable. Services that are provided at Cotton O'Neill Dermatology can range in patients of all ages, anywhere from birth to the end of life. Some of these treatments include UVB phototherapy that treat inflammation of the skin, Mohs procedures, which are tissue-sparing procedures that we use to treat skin cancers, surgical excisions that can be done for skin cancers, cysts, lipomas, etc., and cryotherapy, which can be used to treat actinic keratoses, superficial skin cancers, and benign skin lesions. On the left is an example of a Mohs procedure and the breakdown of what it's like to go layer by layer treating a skin cancer. If you're not familiar with what a Mohs procedure is, the patient comes in, they're numbed with lidocaine. The image on the left is an example of what the Mohs procedure entails. If you are not familiar with what the Mohs procedure is, it is a tissue-sparing procedure where a piece of tissue is evaluated under the microscope. If the outside margin of the tissue is still positive for skin cancer, another piece of tissue will be removed, and this process will be repeated until the patient is completely skin cancer free. While the tissue is being processed, a temporary bandage will be placed on the patient and they will wait in the Mohs waiting room. From start to finish, these procedures can take anywhere from an hour to several hours, depending on how many layers that we have to take. The image at the top right is a full body UVB machine. Patients typically come into office 2 to 3 times a week, depending on their skin condition. This machine is used to treat inflammatory conditions of the skin such as psoriasis, eczema, and prurigo nodularis. The image on the bottom right is of a cryotherapy gun which holds liquid nitrogen and is so cold that it burns. This is used to treat precancers, superficial skin cancers, skin tags, warts, and other types of benign lesions. Stormont Vail employs a complex organizational structure. This means that the highest level of responsibility begins at the top of the organizational chain, such as the board of directors and the CEO. Following the board of directors and the CEO would be the senior vice presidents. The structure is then broken down into several independently operating departments, each of which is managed by a vice president. Some examples of these departments include marketing and communications, IT and informative services, clinical operations, specialty care, acute care services, primary care, strategy and regional development, and quality and population health. Some pros for this type of structure include that it allows for a more specialized expertise within departments. It has clear roles and responsibilities, encourages teamwork and collaboration, provides room for personal and career development, and achieves high levels of efficiency. Some cons that are found with this kind of structure are increased cost due to several layers of management, which can be expensive. It can lead to more competitive conflict between departments, creating communication barriers and slower decision making if changes is happening organizational wide and not just department specific. And it can lead to a potential bureaucracy due to excessive rules and procedures. Some recent challenges that have been found at dermatology include staffing. We have recently implemented a new formula that is being used that determines the number of patients who are being seen on a particular day, and then determines the number of employees that can be staffed into the clinic. If there is not a sufficient number of patients, employees will either be reassigned to areas with staffing needs or have the option to use their PTO or take the day off without pay. This has led to stress on several employees due to the need to have full-time hours to make ends meet. This has also caused some of the staff members to become unhappy, and for others, it has even prompted them to seek alternative job opportunities. Over the last few months, we have undergone several changes, including the departure of providers and the onboarding of new staff. Dermatology has slowly been taking over occupancy of the first floor of the Asbury Clinic, raising concerns about available clinic space, including personal desk areas, clinic rooms, and provider offices. This has also led to arguments between departments over who gets what rooms, equipment, and how to divide time on surgical days. Resistance to change has been a frequent occurrence as so many policies have been implemented in the last year. This not only disrupts workflow in the clinic, but also team morale. There has also been several conflicts among staff members due to clashing personalities. This seems to escalate after management changes and no longer having a nurse manager on site at all times. Due to other recent policy changes, we no longer require patients to have a referral before being scheduled for an appointment. As this has made it more convenient for patients, it has also led to a backup of our patients waiting to be scheduled from the work queue, as well as increasing the amount of time it is taking to get patients seen by a provider. For example, our consultation appointments are now booked until mid-October, whereas previously we were able to see them within a couple of weeks. The nurse leader fosters interconnectedness or system thinking by encouraging the team as a whole to participate in generating ideas, engaging in critical thinking, implementing process improvement strategies, and resolving conflicts. Team building exercises and huddle meetings are also good opportunities for the nurse leader to promote system thinking along with the healthcare team, allowing them to work together to innovate, change, and improve the quality of care that they provide. The energy field, mindset, emotional state, and presence of the leader set the tone for those working for them. As mentioned previously, the recent structure changes to upper management has led to a full-time manager no longer being present in our office. Not only is our manager spread thin by trying to oversee 3 clinics, one of which is located on the opposite side of town, but employees and providers have also been on edge, stressed, and feeling as if their concerns are not being heard or they lack support. Negativity tends to have a snowball effect, ultimately leading to larger problems down the road. whereas a positive and confident leader has the power to motivate their team, which increases productivity and success of the nursing team, as well as creating a positive work experience for our coworkers. Non-linear, non-hierarchy thinking is demonstrated by empowering everyone in the organization to discover their strengths and reach their full potential, whether by pursuing a new position or furthering their education. For example, at Stormont Vail, they offer an emerging leaders program that is open to all employees, providing leadership experience and creating new opportunities for growth within the organization. The department has not adapted well to recent changes with staffing, seating arrangements, and adjustments with new providers and teams. Our leader is comfortable, confident, and adaptable when it comes to carrying out changes. However, when conflict and pushback arise during the change process, it can become chaotic because she takes negative behavior personally rather than associating it with the change. Overall, the dermatology team is aligned with the organization's mission and values. Our nurse manager places a strong emphasis on respect, teamwork, and quality care. If any of these values are violated, she is quick to address the situation and ensure that the behavior and/or actions are not tolerated. Evaluating the leadership. As healthcare evolves, nurse leaders are increasingly adaptive. To be a strong nurse leader in the modern healthcare world, it is essential to adopt this approach in your career, enabling you to navigate challenges and lead your team to success. To name a few of the quantum leadership traits that our nurse manager possesses are honesty, transparency, self-awareness, a purpose-driven mindset, empathy, and most importantly, she's humble. Although she carries the title of nurse manager, she treats everyone fairly and is the first to take accountability for things that do not go well. She is honest and upfront with us about policy changes, and although she may not always agree with some of them, she helps us to find the good and positive aspects in every situation. Understanding that healthcare is constantly changing and ensuring your team has the proper tools to adapt efficiently is critical. By possessing quantum leadership traits, staff will be equipped to work together to achieve the organization's goals, ultimately setting new standards for dynamic healthcare environments and providing the opportunity to deliver optimal, patient-centered care. Recommendations for practice. Since our manager cannot be in the building at all times and is frequently unavailable due to workload, she could hold once-weekly meetings where staff can bring awareness to any potential concerns or care gaps. Following the meeting, an email summarizing the meeting can be sent out with the plans to address the problems discussed during the huddle. This will ensure that those who could not attend the meeting will also be up to date on important information, and everyone will feel as if they are being supported and heard. Unfortunately, there are times when staff are assigned to be floated on days when we have a low census. Yet there is also no need for them in other units or departments, so they are given the choice to either use PTO or take the day off without pay. This has been a regular occurrence lately, causing some staff to exhaust their PTO and have no option but to stay home without pay. For this reason, staff would benefit from the option to volunteer to take the day off, allowing those who need to work their hours still to do so. This will also improve employee satisfaction rates and help to retain staff for more extended periods of time. 2 to 3 staff can be assigned to do an urgent lesion clinic. These staff would take turns checking the patient referrals for urgent conditions. These staff members would then check with the dermatologist and find a time when the patient could be accommodated. Provider offices can rotate the days on which urgent referrals would be assigned to them. These patients would be notified that during this work-in appointment, we would only be addressing the urgent concern, and then they would be scheduled for a follow-up to do an overall skin check to address the other less pressing concerns they might have.